Hello everyone, for today's video, we're gonna talk about Canine Parvovirus. Canine Parvovirus, or commonly known as Parvo, is a highly contagious virus that can affect all dogs, but unvaccinated dogs and puppies younger than 4 months old are the most at risk. The virus affects dogs' gastrointestinal tracts and is spread by direct dog-to-dog contact and contact with contaminated feces or stool, environments, or people. The virus can also contaminate kennel surfaces, food and water bowls, collars and leashes, and the hands and clothing of people who handle infected dogs. Parvovirus is resistant to heat, cold, humidity, and drying and can survive in environment for long periods of time. Even trace amounts of feces from an infected dog may harbor the virus and infect other dogs that come into the infected environment. The virus is readily transmitted from place to place on the hair or feet of dogs via contaminated cages, shoes, or other objects. After the parvovirus treatment, it is highly recommended to disinfect the whole house or area before bringing home another puppy. Signs of parvovirus. Some of the signs of parvovirus include lethargy, loss of appetite, abdominal pain and bloating, fever or low body temperature, vomiting, and severe, often bloody diarrhea. Persistent vomiting and diarrhea can cause rapid dehydration, and damage to the intestines and immune system can cause septic shock. If your puppy or dog shows any of these signs, you should contact your veterinarian immediately. Most deaths from parvovirus occur within 48 to 72 hours following the onset of clinical signs. Diagnosis and treatment. Parvovirus infection is often suspected based on the dog's history, physical examination, and laboratory tests. Fecal testing can confirm the diagnosis. No specific drug is available that will kill the virus in infected dogs, and treatment is intended to support the dog's body systems until the dog's immune system can fight off the viral infection. Treatment should be started immediately and consists primarily of intensive care efforts to combat dehydration by replacing electrolyte, protein, and fluid losses, controlling vomiting and diarrhea, and preventing secondary infections. Sick dogs should be kept warm and receive good nursing care. When a dog develops parvo, treatment can be very expensive and the dog may die despite aggressive treatment. Early recognition and aggressive treatment are very important in successful outcomes. With proper treatment, survival rates can approach 90%. Since parvovirus is highly contagious, isolation of infected dogs is necessary to minimize spread of infection. Proper cleaning and disinfection of contaminated kennels and other areas where infected dogs are or have been housed is essential to control the spread of parvovirus. The virus is not easily killed, so consult your veterinarian for specific guidance on cleaning and disinfecting agents. Preventing parvovirus. Vaccination and good hygiene are critical components of prevention. Young puppies are very susceptible to infection, particularly because the natural immunity provided in their mother's milk may wear off before the puppy's own immune systems are mature enough to fight off infection. If a puppy is exposed to canine parvovirus during this gap in protection, it may become ill. An additional concern is that immunity provided by a mother's milk may interfere with an effective response to vaccination. This means even vaccinated puppies may occasionally be infected by parvovirus and develop disease. To protect the adult dogs to parvovirus, pet owners should be sure that their dog's parvovirus vaccination is up to date. There are titers available that measure the dog's level of antibodies against the canine parvovirus, but the antibody level may not directly translate to protection if the dog is exposed to the virus. Until a puppy has received its complete series of vaccinations, pet owners should use caution when bringing their pet to places where young puppies congregate, such as pet shops, parks, puppy classes, obedient classes, kennels, and etc. Thank you for watching. Don't forget to like, subscribe, and share our video.